Here we go with another great announcement today. Thank you all so much for being here. Thank you all, and welcome to Doorhouse. It's a place that serves as an example of how our mental health system is working right here in San Francisco. This is a place that people who are in crisis can come and immediately get help and transition to possibly a two-week stay, and if necessary, a 90-day stay, because we know that someone in crisis who needs help and assistance, it requires a lot of support and a lot of wraparound services, and this is a great example of us doing it right in San Francisco. But while this is a great facility doing significant work, it is just only one tool we have to address the challenges that we see playing out on our streets every single day. People who are suffering from mental illness, people who are suffering from addiction, we see the need and we wonder, why isn't the city doing more? It's heartbreaking and it's frustrating, and we are investing in more solutions to try and address this issue. We've already opened 50 new mental health stabilization beds, and we plan to open another 100 beds this year. We recently announced $3 million grant to expand the Department of Public Health's efforts to help those suffering from substance use disorder. And we're working to expand our conservatorship law so that we can provide help to those who unfortunately sometimes can't help themselves. But each of these efforts, while important, is just one part of a whole behavioral health system. And that system needs greater coordination, focus, and accountability. Because while there are great people doing great work, both in our public agencies and our nonprofit communities like Doorhouse, we know that not everything is working. And that's why in my State of the City address earlier this year, I announced that I will be hiring a director of mental health reform, and that I want one person who is looking at this system so that we can change it, to invest more in solutions that are working and to move away from strategies that aren't working. Over the last few months, we have been searching for someone who had the experience and the expertise and the commitment to take on this issue. And today, I am really proud to announce that Dr. Anton Nigusse Bland will be taking on this critical role. I hope I didn't butcher your name. Dr. Nigusse Bland is currently the medical director for psychiatric emergency services at Zuckerberg San Francisco General Hospital, where every day he sees those who are most in need, and just as important, where he sees the flaws in our systems that leave those in crisis with nowhere to go. Dr. Nigusse Bland is an expert in addiction and emergency psychiatry, and I know that he's ready to take on this challenge. And let's be clear, this is a major effort. He will be tasked with improving our city's efforts around mental health and substance use disorder, including identifying and understanding the exact population that we're trying to help, and creating a system to track services across our entire behavioral health system in the city. He'll be assisting with restructuring and expanding existing services and identifying gaps where improvement is needed, and creating a data system so that we can measure our progress, so that we can measure our success and what we're doing. This won't be easy, but I know that he's up for the task, and he has my full support to achieve this goal. He will report to our new director of the Department of Public Health, Dr. Grant Colfax, and I want to thank Dr. Colfax for helping to lead this effort and for his early emphasis on prioritizing behavioral health in our city. I also want to thank UCSF for loaning Dr. Nigusse Bland while he takes on this very important role. UCSF has always been a partner to us in providing health of our city, and we appreciate their leadership and their support in this very difficult task that we have to do. And we know that it won't be easy, but we are prepared to do what's necessary to make sure that we partner, that we make better investments, and that we do everything we can to improve behavioral health in our city and the challenging conditions on our streets. And with that, I'd like to welcome to the podium the new Director of Mental Health Reform for the City and County of San Francisco, Dr. Anton Nigusse Bland.
Thank you, Madam Mayor. I'm Anton Nigusse Bland. As a psychiatrist, I think of my job and work mostly as establishing safety through listening. Everyone has a story to tell and a reason for the problems they are experiencing. Creating the right environments for people to seek care, to accept help, and also to work on their own behalf to get better, that is in some ways our most basic and our most pressing challenge. In my time at Psychiatric Emergency Services, I have seen people in crisis who are disconnected from care and resources in the community. I often challenge our staff to ask, what are their barriers? What can we do as a system to begin to bend in their direction? I look forward to working with the health department leadership and community partners to figure that out. We have so many dedicated and talented providers and experts in our system. It is a great basis of strength to begin this work. Together, we can develop a strategic approach to mental health and substance use services for people experiencing homelessness in San Francisco. While the system works very well most of the time for most people, we need to focus in on the gaps that leave some of our most vulnerable residents at risk. San Francisco has an outstanding track record of problem solving. I am honored to be asked to serve at this critical time to address the problems of our homeless residents who need mental health and substance use care, but are not able to access it through our current means. We're going to take a look at their experiences, we're going to examine the data, and we're going to assess the programs that are in place. We will build upon what's working and develop new approaches as well. As a city, we can continue to do better to ensure that all San Franciscans have a real opportunity for wellness and recovery. Thank you.
Thank you. And with that, I'd like to introduce our new Department of Public Health Director, Dr. Grant Koufax.
Well, thank you, Madam Mayor. This is really an exciting and inspiring day, and it's really great to see some of the key people who make our system work here with us today. And as I reflect on my first month as Director of Health, I'm struck by how extensive our mental health and substance use treatment is throughout the city. Just for some numbers, the system already provides care to some 30,000 San Franciscans in about 300 programs. We have approximately 2,000 beds in the behavioral health system across the continuum of care, from crisis to acute inpatient care to residential treatment beds and boarding cares. We know that recovery is possible with treatment. And today we are at Doorhouse, which is a great example of a part of our system that is working well to help people recover. We know that there are many effective programs in our system to meet individual needs. That is so important because mental health and substance use problems are nothing if not personal, individual situations that play out differently for everyone. But we must and we can do better. We need to lower barriers and make it easier for people to experience recovery and wellness. For many of our most vulnerable residents and their families, the system can be confusing and hard to access. We must collaborate better with community providers, patients, families, and other stakeholders to design a more client-centered model of care. We must have a system that responds better to the mental health and substance use treatment needs of people who are experiencing homelessness or those at risk for ending up on the street. We need to make sure we are implementing the most evidence-based tools, optimizing every dollar for care, delivering culturally proficient care, and most importantly, demonstrating results. We need to scale up what's working and end what's not. I am grateful that Mayor Breed has decided to face this issue head on. With her leadership, I am optimistic about the new Director of Mental Health Reform catalyzing our moving forward in the right direction. Dr. Anton Nigusse Bland comes to us with stellar experience in psychiatry and addiction psychiatry. He has been medical director of the psychiatric services, emergency services at Zuckerberg San Francisco General Hospital, thereby being on the front lines of mental health and substance use crisis. He sees the issues we are facing and trying to solve every day. We are grateful to him and UCSF for agreeing to make this innovative new position. Dr. Bland will work directly with me to develop a strategic approach to mental health and substance use services for people experiencing homelessness in San Francisco and those at risk for being on the street. He will help us to assess the system from a patient's perspective and by looking at the data. He will identify successful models of care and opportunities for additional resources or service expansion where things are working. He will ensure that our investments are informed both by science and the people we serve. We are fortunate to be taking this step forward today, and I look forward to working with everyone for more improvements in the future. Thank you.
Thank you. And Dr. Nigusse Bland is on loan to the city from our great partner, UCSF. And I want to welcome to the podium Dr. Matthew State, who is the chair of the Department of Psychiatry for UCSF.
Thank you, Madam Mayor. It is wonderful, truly exciting to be here today for this incredibly important announcement. I want to thank Mayor Breed, Director Colfax, of course, Dr. Bland, as well as all our community partners and advocates who are here with us today. I'm Matt State. I'm the chair of the Department of Psychiatry at UCSF. And as I said, this is an extraordinarily exciting day for us. Looking forward to this wonderful partnership. It's truly inspiring to have the mayor and our city leaders take such an active role in addressing the pressing challenges of mental health and substance use disorders. And it's incredibly rewarding to have UCSF faculty like Dr. Anton Bland being able to play such an important role in this effort. As you know, the city and UCSF have a very long history of highly productive partnership. And as the representative of UCSF here today, I can't stress enough our eagerness and commitment to continue to working closely with you and with you, Director Colfax, to address the major healthcare challenges we face. As leader of the Department of Psychiatry, it's particularly rewarding for me personally to be able to help support the remarkable work that's being done as a partnership between the city and UCSF at Zuckerberg San Francisco General Hospital and in our associated community-based programs. Our Department of Psychiatry is the second largest service department at ZSFG, serving more than 13,000 individuals and families annually. The faculty and staff at ZSFG are incredibly talented and dedicated, and they are, as Dr. Colfax said, really on the front lines of national crisis. Our doctors, whether they're in the psychiatric emergency services, our inpatient services, our child and adolescent services, our division of substance abuse, our trauma programs, our community-based wraparound programs, jail psychiatry, are all struggling not only to help patients who are struggling with their illnesses, but very often are also facing homelessness, poverty, exposure to violence, marginalization, and stigma. In this environment, Dr. Bland has shown himself to be a remarkably gifted and resilient leader. As director of our psychiatric emergency services, he's been a highly effective leader who has a deep, deep understanding of the mental health challenges the city faces, as I'm sure you could tell even by his brief remarks. He brings a remarkable mix of clinical excellence, administrative skill, and very importantly, a deep compassion for every patient and family that he interacts with. In taking this position, Dr. Bland will join an already outstanding team at DPH and working throughout the city who are addressing this challenge day and night. And with the active support of the mayor, Director Colfax, our community partners, and I guarantee every person at UCSF, I'm confident that he will help achieve lasting and substantive change that will impact the lives of the most vulnerable patients in San Francisco. So thank you again, Mayor. Thank you again, Dr. Colfax, for your leadership and for this vision in creating this important position. And congratulations and best wishes to you, Dr. Bland, as you begin your tenure as the inaugural Director of Mental Health Reform in San Francisco. Congratulations.
Again, thank you to UCSF for their partnership in this effort. We are truly grateful for their support, and I think that this is going to be absolutely amazing for our city, and it is primarily due to our working relationship with UCSF and the resources that they continue to provide to support our programs here in San Francisco. I also like to just acknowledge and thank the Progress Foundation and Door House for their support and the work that they continue to do in San Francisco, as well as another community partner, Positive Resource Center, and Brent Andrews. Thank you so much. All of the work that you all do to work with communities and to continue to make sure that San Francisco is at the forefront of addressing what we know is a serious crisis, not just with so many people, sadly, that are suffering on our streets, but people who need help, they need support and need resources. And it is time that the city has taken a really hard stance around trying to reform mental health in a way that removes the stigma so that we can get people the help and the support that they need. So I'm very honored and grateful to Dr. Nigusse Bland, who is stepped up to the plate to take on this incredible responsibility, and I know he's going to do an incredible job. So thank you all so much for being here today.